It could be about cancer, diabetes, tuberculosis, malaria. You have to want to know. It's very important. And to cover the health bits, you need to read, you need to seek information. It's not all about the fact that, oh, because I'm a producer, for instance, I run a health program, I'm going to have the medical experts come sit in in that particular program to talk about health issues. And for that reason, you're not making extra efforts to read, do your research, compare notes, find out what's happening in the health space, particularly as it concerns maybe the public health issue you want to bring on board. So you have to do your own research, because sometimes you could have those health experts who possibly you're meeting for the first time and you bring on your show. Trust me, some can bring up false information. And if you're not, also doing your research, you can put out the right questions or possibly challenge, some of the things that sound confusing or contradictory. So it's very important that you do your research, and that will help. So I've talked about curiosity, I've talked about passion. I think it's a field where you need passion, because you also hear that because you're a journalist, you can cover health. Some person will not last in that field. That's the truth. If you don't have passion for it, if you're not curious about, knowing much more. Because let me use the scenario of the COVID-19 period. We had COVID-19 happen and the lockdown and how serious it was. We saw people dying for real, and everybody, almost every journalist wanted to report COVID-19. But obviously you could tell, the difference with someone who was already a beat reporter, a health reporter, telling the story differently, approaching the topics or the issues around COVID-19 differently. No matter how much those other persons wanted to be in the COVID-19 space, some were just there because, that was a time to make some more money per se, because, it's COVID-19, I could just report it and, get some money. For persons who it's their base, they would approach it differently. So as much as possible, you must be interested. Interest is very key. I think that's the first thing. Because so having established that, it's also very important to understand that you need to reach out to the right experts. So we have the medical field is very broad. We have doctors who are specialized in, a number of medical areas. So, for instance, you want to talk about maybe diabetes. It's be wrong for you to reach out to just any doctor. So general practitioners can discuss a number of issues, but there are specialized topics that you shouldn't have someone who is not, an expert in that area come to talk about it. So these are things to pay attention to. You have to get, for instance, an endocrinologist who is an expert in talking about or in dealing with or managing diabetic patients and can speak from an expert's point of view, from a vantage position about diabetes and other areas as well. So you have to be extremely careful. That's something to pay attention to, the right experts who would teach you or be able to talk about a particular public health concern the right way. And a number of times when you reach out to some of the medical doctors, they would even tell you, some are open enough to tell you, sorry, I'm not the right person to speak on this. I would refer you to the experts who can talk on this topic, because this is a more specialized area. So that's something to pay attention to. So we're talking about the know-how. Another thing to also look at is, the ethical side of, doing health reporting. There are certain things you cannot take for granted. Ethical considerations are very important. You talk about accuracy and fact-checking. What information are you putting out? Because trust me, once you continuously get it wrong, your maybe platform is notorious for pushing out information that are not true, then people won't believe you. You're no longer credible. So a lot of persons will not come to your space to get that information. They wouldn't. So ethical considerations are very important, like accuracy and fact-checking. Fact-check that you heard something is not okay for you to just think that, this is what it is. You have to fact-check. And how do you also present, those information? The framing is also very important. How do you frame your content? Sometimes you would also hear that it depends on how the presenter presents a program. That would also attract attention to a large extent. And then patient privacy, that's also very important. So a number of times I've had, persons who are survivors on the health program that I produce. So I'm a producer of the health program. It's a 30 minutes program on radio. Every week we come on air to talk about different public health issues, and either we field medical doctors or we bring in persons who have experienced certain health concerns, have been hit by diseases, and they have come out of it. They come to share their story. And as much as possible, you have to be sure that the person is okay with the face being shown. Radio is no longer radio like it used to be, because we get to stream in our studio, so you can watch online. We've gone beyond the four walls of radio, just being, we're just hearing the voices. You get to see people's faces now. So you have to be sure that your guest is fine with telling her story or his story and being seen. So these are some of the things to consider. Patient privacy, are they ready to reveal themselves or just show themselves, or just want to tell their story and walk away? So you have to consider this as well. Then balance and fairness. Okay, you're trying to say something.
I'd like us to backtrack a little, just to ask some questions about putting out the right content. So I'd like you to please address how we can be able to get truthful content or truthful information to share to the public that will not cause any chaos or will not cause spreading of fake news, especially since we know that it has to do with health. During the coronavirus period, like you mentioned, if there were some people that did not disseminate the truthful content, it could have caused chaos. But so I would like you to put us through on how to be able to get truthful data or truthful information to put out there so that nothing bad will happen. If you can please share more light in that area.
Okay. So, like I talked about fact checking, there are different sources that you can go to, and you can rely on certain information from sources that are reliable to back up whatever you're putting out there. If, for instance, there is a report on a particular maybe disease, and you're not very sure of the information you're seeing, or the information that is put out there, you're doubting possibly the veracity or how potent that information is, there are ways that you can do your fact check. So before I come to possibly your local community, let's look at maybe certain information that have been put out. You can, for instance, go to the World Health Organization website, to do a double check on what possibly the WHO is saying on the particular, patient. And so there's also dynamism in the health space. There are updates on certain maybe guidelines. Let me use this scenario. So in malaria treatment, or malaria prevention, or malaria control generally, I think years back, we had a situation where it was okay for you to walk into a hospital and clinical diagnosis is done. So clinical diagnosis simply means a situation where you're just going into the hospital and you meet with the doctor, and the doctor is telling you, or you tell the doctor what you feel, your symptoms. Maybe I have headache, I'm feeling generally weak, just sharing your symptoms with the doctor. And based on the symptoms that you're giving to the doctor, you're prescribed, medication to deal with, or take that can actually handle whatever you're feeling at the moment. Oh, okay, I think you have malaria based on what you told me. I think years after, very recently, we had a situation where the World Health Organization eventually said and updated the guidelines, insisting that a lot of medical facilities or the healthcare centers shouldn't, treat malaria based on clinical diagnosis. They should rather have the patient do a test. Either you're doing the rapid diagnostic test using the RDT, or you're walking into the laboratory to have your blood screened to be sure you have malaria. So if, as a reporter, you have to write a story and maybe you're basing your report on something that the World Health Organization has said like years back, and you're not aware that there's an update of that particular guideline, it puts you in a very tight corner, because the guidelines on they can treat clinically by just diagnosing clinically and giving medications to the patient, and not necessarily do a test. We've moved from that to ensuring that patients get, screened. It's a guideline that you must follow. So I did a report on that some years back, and it was just very interesting to realize that there was an update. But then we still had some health facilities that were still treating patients based on clinical diagnosis, and that's against the World Health Organization standard. So that's part of what I'm talking about. You need to do your findings. If that's what the World Health Organization is saying, then that's exactly where you should stay, because those are the standards that you should base, for instance, your report on. The medical doctors are trying to align with that, policies of the world, in terms of health, and ensuring that they connect with that guideline as much as possible. So that's just an instance of you doing your fact checking, making sure that your report is up to date. What is the present research finding? What is obtainable at the present moment? You have to ensure that you connect with that totally, if you have to, put information out. So that's an example. Or sometimes I talk about maybe your local space. You're not very sure of what you're seeing. For instance, I think recently we had a situation where there was an outbreak of cholera, yes. And there was so much emphasis on the fact that, do not eat fruits, from persons on the streets. Don't buy fruit that are already open. Buy the ones that you can go back home to cut open and then wash yourself. And there was this report that was being circulated that, people were getting infected. I think it was a Lagos outbreak, cholera outbreak in Lagos State. And there was this connect that some persons were drinking tiger nuts. Were taking tiger nuts drink, and they were getting infected from that drink. And so generalizing that, you can actually get cholera from taking tiger nuts drink. That wasn't the information. The information was that, based on water used to prepare the tiger nut drink, which is contaminated, it was leading to cholera. So you have to put those information straight. And so as much as possible, you could even call a medical doctor around to put into proper perspective for you what you're hearing, because there are experts that can explain things better. And so that's where the fact checking comes in. It's extremely important that it must be accurate. Extremely important, because when you keep putting out false information or information that is not accurate enough, you're not credible, and people would move away. They wouldn't want to listen to you next time.
Also, I would also like to ask if there are stories that you think we should not push out there. Is there a limitation to the kind of health story that we can actually share to the audience?
Is there a limitation to?
Can you take that again, please? Is there a particular disease or a particular health story that you think that we should not disclose to the audience, that we cannot write about, or we can cover any health story?
Okay. You can cover as much as possible. There are lots of stories to cover, but at the same time, like I said, it also depends on you paying attention to the ethical side of things. The audience or the citizens deserve to know as much as you can think of. They deserve to know a lot. Sorry, I apologize. I just put my laptop, so what happened to the camera? Okay. Okay. I don't know if this is better. I'm just trying to. I apologize. Sorry about that.
This is echoing.
Okay.
All right, please hold on, David. Yeah, trying to sort out the audio.
Okay, can
Apologies.
you hear me?
Okay, we can hear you
I
without.
apologize. I think at some point it looks like I could connect on my laptop, and so that's why you're hearing the whole back. Okay, so
Yes.
to answer your question, there's a lot we can report on. There's a lot happening. Um, um, there are lots of health stories around that we can actually report, or we can, do programs around. But then, yes, I would say yes to that question, because you have to be careful what information you're also putting out. If you know too well, there's been this very deep, uh, should I call it a war or controversy around vaccination? You know,
Mm,
talk about the COVID-19 vaccine. We've had like a section of the society say that, there's a lot happening. You shouldn't get vaccinated with COVID-19 vaccine. But recently, I got drafted in to the Pediatric Association of Nigeria platform because it needed like journalists who could also help, to heighten the awareness around vaccination, the COVID-19 vaccines. And so what really happened was they've had to also push out certain information around how potent vaccines are. Vaccines are not totally, bad. You keep hearing those narratives. So I would say yes, because as a journalist, if you want to jump on that, to say, okay, I'm hearing a lot about, vaccines and, this negative things about vaccines, and you want to now put a report on that and staying with the fact that, oh, vaccines are this and that, we still do not have a finality on that. We know how much vaccines have saved lives. Personally, for me, when I talk about vaccines, for instance, I try to remember my own children. While growing up, I remember my mom telling me, because I think I remember seeing a younger sister. She had given birth to a younger sister, right? And so in a few days after she came, she was no longer there. It took a while for me to understand why she didn't survive. I think just maybe days after she came or weeks after she came, she had measles.
mm,
She had measles and she did not survive. She died. Why? My mom would tell me years after how it was difficult to access vaccination. Then we did not have this much vaccination. And she can boldly attribute the fact that my sister did not survive because she wasn't vaccinated. And now I have children. I have 3 kids. And I diligently follow through the vaccination for the children, from 0 to 5 years. And I can say boldly that there's a whole lot that vaccines can do for children, positively protecting them from diseases, and so it's a different ballgame. My mom is still alive, for instance, and she would tell me, that there's a whole lot of difference with when she had children and now. So as a journalist, would you jump on the story of saying vaccines are not potent when there's still no finality around it? So yes, there are certain things that you shouldn't, want to put out or report, particularly because research is still ongoing. A lot of persons may be pushing that narrative. That's why we also have, the vaccine champions. That's what they call them. The Pediatrics, Association of Nigeria are champions, and they drafted in some journalists to also help to push, the message around how potent vaccines are, and to still encourage, society to embrace it. Because after COVID-19, I am sure you know that in the days ahead, we're still worried about what the next, disease outbreak would be like. That might just come, anytime soon. We can never tell. So for the sake of public health, there are certain information you shouldn't jump on and you shouldn't be ready to quickly share. As a health journalist, you should be even more cautious when you see some bloggers put out some information, and because they want to, attract people to their blogs, they want to attract persons, to click, sometimes the headlines are misleading. You have to be extremely careful what you consume and what you want to give out to your listeners. Because your listeners, the citizens depend on you, as a health reporter to break things down for them to understand. So you are definitely going to be very, very careful.
All right, man. All right. So we also like to know if, apart from the WHO website or going to meet medical experts in the area where we want to cover, are there other ways we can get legitimate information, legit information? Is there other websites or any other means we can get this one?
Okay, yes, there are the number of resources where you can look out for health information as a health journalist. Beyond the World Health Organization, we also have other, platforms. Some medical platforms like the Lancet. The Lancet, if you Google the Lancet, they have lots of information on health. We also have, so if you go online and you just, want to Google and find out where you can get, there are lots of resources where you can get, but you also have to be careful what platform. Is it reliable? That's the question. Is it reliable? So I try to stay with the health bodies. We have, for instance, UNICEF. We have other platforms, global platforms that you can refer to. So, for instance, if within the health space, doing health reporting, there's still like a subset of maybe public health focus that you can also still specialize in. So I also am interested in HIV reporting, and that's another very technical field where journalists have to pay attention to what they put out. In fact, it's very sensitive because your framing is extremely important. You're dealing with most times persons who are already infected with the virus, and how do you address certain issues? So, for instance, the National Agency for the Control of AIDS, you need to talk about HIV, you should go there. Their platform is there for you to check it out. Across the 36 states of Nigeria, we have, the local and the subnational agencies. That's the state agency for the control of AIDS spread across. If it's Akwa Ibom, it's Akwa Ibom State Agency. If it's Bayelsa, so we have in all the states. So if you're getting information, then that's where you should tilt towards. It might not be online, but if they have a facility, you can always walk into their office to get that information. So you're on the right path. We also have on X. I'm on X a lot. So I follow a lot of health organizations, health bodies on X. I subscribe or I follow them. So if they drop messages sometimes, I might see that on there. We have, for instance, UNAIDS, is on X. So most times they tweet or they put out messages. You definitely see that right there. And other organizations as well. So another one in Nigeria that I subscribe to, and I have so much respect for them as well because they're doing a great job. Beyond just having to put out certain information, they have a couple of journalists who also push out a number of stories. So I would say boldly that health is about humans. Health is human interest centered. So as much as you're putting out information about the particular disease, you're saying, okay, this is this, we have all the facts put out, you break down the technical words. At the end of the day, it is about, people. Health is about people. So you definitely would have, human angle stories. And so for the Nigerian Health Watch, that's another platform, another good platform, Nigerian Health Watch. I subscribe to their newsletter and I get it every week. There's always something they're putting out there, and from there you can get story ideas as well.
Thank you so much. So for those that have questions, we'll be expecting your question, and we have one question already, ma'am. So it says that I have heard a number of people talk about body size in relation to media, especially in TV presentation. What's the real truth behind this?
Body size?
Yes, I think the person, yes. So I'm also trying to understand the question, but I think the person is talking about how you look like in relation to you being a TV presenter. I'm not sure.
Okay, so I'm starting to hear you at this point. So if you can take the question again.
Okay, it says that I have heard a number of people talk about body size in relation to media, especially
Hmm.
TV presentation. What's the real truth behind this?
Hmm. So body size in terms of if the person is big, bold, and beautiful, I'll describe it that way: big, bold, and beautiful. Is a question referring to can the person still be on television, for instance, or is that going to affect the person's presentation? Or if the person is, slim, petite, does that affect anything? Is that
Yeah,
what the person is trying to say
I guess so
in
too,
terms of
because I know that
presentation?
there's a myth behind there's a myth that is not so true, and it could be true, that how you look actually determines if you get a job as a TV presenter,
Hmm.
or even now that
Okay.
video is now live on social media. So a lot of
Oh,
people
okay.
probably take into consideration how you look, your body size. They prefer probably slim, tall, or slim and
Hmm.
fair in relation to is this
Hmm.
person qualified or not. So she wants to know how true that myth is. That is it true that they consider your body
Okay.
size? I think that's what the person's trying.
Okay. This is a very interesting one, and I can't help but just laugh. Because I think that maybe for television, we might have to worry about how a person looks because for TV, you have to look attractive. That's the
Mm-hmm.
truth. Or you have to look in certain ways before you can actually be put on front of the camera for the world to see. I know television will pay more attention to how a person, but for radio, and just like you said, because we now have the cameras in the studio and we are streaming live, we are trying to connect the traditional radio to online, version of things. That still matters. A number of times you realize that people with you know, sometimes beautiful voices on radio. I've had situations where people get to see such persons and they're like, "Oh, is this what you look like?" Wow, you don't look like what you sound like. We hear those things a lot of times, but I don't think that should affect anything. For some, like I said, some platforms mind, because on TV there's a particular way they expect. There's a standard for possibly how the person looked before the person looked put on in front of a camera. But for radio, I think radio, I still enjoy the part that radio you don't get to see people's faces. This new format of having to do cameras in the studio and you're streaming is not something I really like because at the end of the day, we just love that part where our voices are just heard. And you always like that effect of, oh, this is you. I hear you a lot on radio. Wow, I thought you were an older version of what I'm seeing. I thought you were bigger. I thought, oh, you're this slim. I've gotten those reactions a number of times. But I don't think that should be a problem. If you think you have what it takes to, do radio, or maybe you want to be a presenter, I think there's also that part of podcast happening. So if you for some reasons you're rejected on a particular platform because they feel you don't fit into what they want, you can go do podcast. Use your voice to still impact lives. There's podcasts and there's audio podcasts that you can, fall in line with or lean towards. You don't necessarily have to do TV, or you don't necessarily have to be there for everybody to see you. People should enjoy listening to the audio podcast without necessarily watching. That's the truth. So it's not enough for you to feel discouraged and feel like, oh, I don't fit in here. Look for where you fit in and still live your dream and still follow through, what you want to do. If this is the space you want to, function in. That's what I
Thank you
think.
very much. All right, please, if you have more questions, kindly drop them, and our guest will definitely react to those questions. So I also like to know that are there some, for instance, if you're interviewing someone about any health topic, are there some things we need to avoid apart from minors or people that you think that okay, are there some sensitive questions that we should avoid while asking questions or getting information from people with health challenges or anything that has to do with health. So that would be one of the last questions I asked today.
Okay, so you're talking about while interviewing, and
Yeah.
now you're interviewing people, real people. Okay. Yes. Having real persons in your space, and then you have to carry out interview. For instance, let me use the scenario. You have a cancer survivor. I've had to talk to about two of them very recently, coming to share their story on how they were able to survive cancer, the period of treatment, and having to go through that and surviving that. You have to be extremely sensitive of the kind of questions that you ask. It's not a time to be careless, by asking, certain things. Definitely, you have to be extremely careful what questions, you put out and how you go about asking your questions. I'll come back to the cancer survivor, but then I talked about, also being in the HIV space, HIV control, epidemic control space. And so I've had to work with persons living with the virus, a number of them. And I tell you that these are people that can be extremely sensitive. So you need to be extremely careful how you handle them, how you go about asking your questions. Most people would, or a lot of persons, maybe not most, because awareness is getting heightened, but a number of persons will think that to have HIV, maybe the person was promiscuous or it was through sex. You don't only get HIV through, sexual intercourse. There are other ways that can happen. It could be blood transfusion, a prick of the needle at some point. So there are different ways you can still contract the virus, not necessarily through sexual transmission. So if you have, for instance, someone living with the virus who is in your space and you're having an interview with the person, possibly the question shouldn't necessarily be how did you contract the virus, or you could just avoid that, because what if that was how the person contracted? You could just maybe be, when did you know your health HIV status? When did you find out you had HIV? And it could just end there. And other questions that might also be sensitive, you need to be extremely careful. What questions should I ask? What questions shouldn't I ask? Those are very important things to know. And so I agree that when you have persons like that in your space, you need to be more cautious how you interact with them, what questions you put out, because your interview can just end right there if you don't ask the right question. The person becomes very uncomfortable and might decide to just walk away. And maybe you have someone living with the virus and you're asking the person, have you infected someone before? That's not a necessary question to ask. So there are certain questions you should avoid, and that will come from doing your due diligence to find out what you can ask, such people.
All right, ma'am. Thank you very much. Really appreciate you for the time you spent with us, and probably just one parting sentence just to encourage us on those that want to trying to help. Just give us a word of encouragement as we wrap up, please.
Okay. Like I said earlier, I think this is a good platform. Mentorship is very important. It took me years, to really understand that I could do much more. Started off as a newsreader, and for a long time, I just realized that this is not all there is to broadcast journalism. I need to show up much more. And so when I found,
I think the network. So am I the only one not hearing
I think the network.
Yeah. Okay. So the network. All right. Our time is past 10, and I don't know if there are any other questions, but
Yes, there's a question here. Let's hope that she's going to connect shortly. There's a question here on YouTube. Hopefully, our guest is going to join again, and we're going to ask her in the next like 2 minutes. Someone is asking on YouTube, is sir and ma during interview necessary, especially when you're trying to pay the respect game or play the respect game? So let's just pause and hopefully. Let's wait for like 1 minute and then we hope to reconnect with her. Thank you, everyone. Okay, while we wait for our guest. Okay, while we wait for our guest to join, let's just start doing a recap of what we've heard so far from our guest to keep our audience engaged. Priska, would you do the honors?
all right, all right. So what I picked so far is that if you want to go into health journalism, you have to have the passion for it. You have to be curious. You have to what broadcasters, mass communicators called. You have to have the nose for news. You should want to know what is going on, and so that you can be able to carry the public along. You should also be interested to know about health
Okay,
issues.
sorry, network threw me out.
Yes, welcome, ma'am.
Okay,
All right,
thank
so we have a
you.
question. I like Bridula, please share the question with us.
Okay, we have a question on YouTube for our guest. The person says, is sir and ma during interview necessary, especially when you're trying to play the respect game? Is using sir and ma during interview necessary, especially when you're trying to play the respect game?
Okay, yeah, there's no hard rule to that. I wouldn't think it's out of place, particularly if you've done a profile of your guest, so you know who you have on air at that moment. You know who you're interviewing. If the person based on the profiling, or most times you have the guest come in ahead of time, before the interview starts. So if the guest is comfortable with that, I don't think it's out of place. So it depends, on the platform with which you are having that interview. I know there are times that they try to discourage you from possibly, staying with the sir, the ma, so it doesn't look like, oh, you have a guest that might eventually bully you because you're showing so much respect. You also have a choice of not doing that. You can call the person by name. So if the person is Dr. Ifeanyi, for instance, Ifeanyi Chukwu, for instance, I'm just using the name, I'm not referring to anybody here. You could just stay with Doctor, did you say, or Dr. Ifeanyi? Doctor, you could just stay with that, not necessarily saying, oh, ma, but there's no hard rule to that. I believe that if you feel it's necessary based on the person you're speaking with, there's also always profiling done. If I have to interview someone, I go the extra mile to check up on them to see who the person is, just do a bit of profiling on the person. And if I have an opportunity to speak to the person before the interview eventually starts, I know what the person would possibly be like to an extent, and what can work or what can not work, and it's not also out of place to ask the person what are you comfortable with. So I don't think there's a hard rule, but as much as possible, if you think the person is going to be extra, then you might just want to remove that from how you have a conversation by bringing in so much Samra. It could just be there. It could be create a lot of distortions or distractions. So just stay with, maybe at intervals you want to refer to the person, you just mention the person's title and the name. I think that's fine. Or reduce how many times you have to, repeat the person's name or titles from time to time. You want to remind the audience that you have a particular guest, then you just stay with the person's title. It could be Professor this, Professor that, Doctor this or Doctor that, and I think that's fine.
Thank you very much for that answer. Sincerely appreciate. All right, so would like Oludolapo to take over from here to give you appreciation for honoring our invitation, ma'am.
Thank you so much, Priska, for a job well done. And thank you to our guest, Imabong Dem. I'm super, super grateful for honoring our invitation. Thank you for not counting us as little and saying definitely an opportunity to share with the younger generation, an opportunity to nurture, to mentor people. And you jumped on this opportunity. So I want to say thank you so much, ma'am. Okay, don't let me even say Sam, ma'am, like I'm already. Are you with me? Oh, it looks like the network is frozen. Oh, I guess it's off the call. Oh, wow. I was in the middle of saying thank you to her for this opportunity, for making us to learn from her and to glean from our wealth of knowledge. I do hope she's going to watch the replay and, of course, see how we're thanking. Okay, she's back. I wanted to say that you're going to listen to the thank you messages I'm dropping already for you. Thank you so much, Imabong, for honoring this invitation. And I pray you keep soaring in your career, in everything you do. And very soon we'll be seeing you on international platforms, dominating the health journalism space. Yes, thank you so much.
Okay, thank you too. I think at some point network threw me out.
Yeah.
But what I want to say is consistency is very important. So for those that want to come into the health space, are interested in health reporting, they should realize that it's not just going to be a space to move in and move out. Be consistent in whatever you do, and it will pay off in the long run. And like I said, passion is very key. Interest, curiosity, you have to be willing to do this and be sure you want to do it and be consistent. I think I'm reaping, some of the benefits of having to stay here, even when it was not very rosy. I think for me, it was beyond thinking that, oh, this is a space where you eventually, get rich or get money. No. So be consistent, keep doing your thing and look out for opportunities. There are lots of opportunities. Already as the year has started, we've had, organizations are already looking for health journalists that can do stuff. 2, health reporting opportunities are out there already, and I'm already looking at applying. Sometimes the year opens up and they're asking for journalists that have reported on different fields, public health issues. They just want those reports and they're ready to give so much money for it. They're ready to give grants for you to follow up on stories. So it's a great field to, report. And basically, you should be more particular about how lives will be touched, how lives will be impacted. Saving lives is what you're out there to do. Making people more health conscious, also contributing your quota is what you're out there to do. So that should be the driving force. That should be the
True.
Thank you.
When you talked about impacting lives, I just remembered my time doing health journalism, how I used to get emotional on the field when I'm talking to people, maybe children that have not been vaccinated or children who are experiencing stunted growth. And I'll just be emotional. I'll get my pen and paper to even write. It will be very difficult because I'll be wondering how on earth will these people not feed their children with adequate nutrients? It's always something that takes away, your emotions are always on the run. But thank you so much again. Network is playing a fast one. I think it's a good time to call it a beautiful night. Thank you. Priska, well done. Next time again on the Media Girls webinar, it's going to be another media girl doing this with us. Have a great night rest. Priska, do you want to say anything?
That's all. Thank you very much for those who watched. We are grateful. And next month is another one, so stay tuned.
Bye.